Squeeze my hand again.
In intensive care on a COVID ward, Dima's life hung in the balance. Her story was a fight for survival.
Well, you can hear me really well.
Filming her long recovery in 2021, we learned that Dima worked for the NHS and had almost certainly contracted COVID at work as a ward hostess, delivering food to patients.
And then you'll be able to talk.
You look strong. Yeah.
3 years on, Dima has a different fight on her hands. Last year, NHS workers were awarded a COVID bonus, but many of those employed on private contracts like Dima didn't get it.
Just lucky I'm alive.
A lot of us risk our lives during that time, working 6 days a week, 12 hours a day through that period. Some people lost their lives, some people can't work anymore, but as I said, I'm one of the lucky ones, and it's just disappointing that we're not getting the payment. I just think it's not fair because we're all there at the same time, doing the work.
Do you think you definitely got COVID at work?
Yes, definitely, yes.
There's a small protest every week at Dima's hospital in Homerton. Doctors and nurses are here, and hundreds of staff who got the payment worth £1,600 signed a petition. But it's the caterers, the cleaners and the porters who missed out.
Yeah, they're a really crucial part of the team. You know, we are one team, and that's why it's, you know, all the more shocking that they're being treated differently.
It is overwhelmingly women, and overwhelmingly, frankly, black women who have not received this bonus.
Some outsourcing companies we contacted have negotiated with the NHS to get the bonus for their staff, but many haven't got it. ISS, the cleaning and catering contractors here at Homerton, say their staff typically don't qualify. And it's the same for thousands of workers in hospitals across the country.
And we estimate that the numbers are going to be in tens of thousands, if not hundreds of thousands of workers. Ultimately, it's down to the extent of privatisation across the NHS. And that's why GMB is urging the Labour government to honour their pledge and get everybody back in-house and back on NHS contracts.
ISS told us they've paid eligible employees, but most are outside the scope of government NHS benefits, and they remain in discussions with relevant parties to extend it to everyone. The Department of Health said non-NHS organisations were able to apply for the bonus for eligible staff, but these companies are responsible for their own terms and conditions of employment, meaning many, like Dima's colleague Sandra, are excluded because of their contract.
Have you got the COVID bonus?
No, I haven't.
And how do you feel about that?
Really bad. I feel bad.
And obviously at the time we all came out on our doorsteps and applauded and...
So why do you clap for others and left others out? It's like they clap for others and left us out, which is really sad.
Yeah.
So
we were clapping for you as well.
Yeah, but we didn't get a bonus, so...
Yes.
Dima won her battle against the virus.
Hello.
Can she win this COVID battle with her employers? Jason Farrell, Sky News.